Hi there, I'm Abi, the Data and Information Lead here at WCMICS. I'm here to talk to you about the impact of Covid-19 on WCMICS Health Services. Let's get started. This is Tina. Tina lives in Melbourne in the north and lost her job in the events industry at the beginning of the pandemic. It's August 2020 and Tina's been in lockdown for weeks with no end in sight. Research tells us that 1 in 5 Australians are reporting high or very high levels of psychological distress linked to the Covid-19 pandemic, with young people, women, and those living with a disability the most affected by poor mental health. A survey released in June 2021 by the Australian Bureau of Statistics also reveals that the outbreaks in Victoria this year have led to a surge in psychological distress, with almost a third of people in the state reporting feelings associated with depression and anxiety, compared with 18% in the rest of Australia. Along with changes to our home life, we've also seen impacts in unexpected places like supermarkets. In 2020, at the beginning of the pandemic, research from the Australian Bureau of Statistics found that compared to 2019, spending increased significantly for both perishable and non-perishable goods. As a result of panic buying, supermarket spending saw a rise in annual revenue of 37.7% for non-perishable goods and 20.2% for perishable goods. But one of the biggest challenges we've seen, which is especially important for us here at WCMICS, is the impact of COVID-19 on cancer within WCMICS Health Services. The COVID-19 pandemic disrupted cancer care, including delaying diagnoses and treatment and halting clinical trials. Despite cancer-related services classified as vital and remaining available, utilisation reportedly dropped due to patient reluctance to access services. Based on reduced notifications, the Victoria Cancer Registry estimate that 2,530 cancer diagnoses were either delayed or missed during the most severe lockdown period between April and October 2020. Using data from the Victorian Admitted Episode dataset, the data team analysed activity across WCMICS Health Services to understand if there was a change in the number of admissions and patients between 2019 and 2020. Let's explore this further. During the year 2020, 72 cancer patients were diagnosed with COVID-19 across Victoria. Of these patients, 44% were treated at a WCMICS Health Service. Between 2019 and 2020, we found a 5% decrease in the total number of admissions. However, when we look at this more closely, we can see that activity decreased during lockdown periods, with decline peaking in August at minus 17%. We're now going to explore the impact on tumour streams in more detail. Our analysis shows us that the largest drop in new patients across WCMICS Health Services was in colorectal, breast and skin cancers. This is consistent with anecdotal evidence and data from the Victorian Cancer Registry. Alongside this, we reviewed the data to see if any tumour streams had an increase in new patients during the year 2020. We found that only bone and soft tissue cancer increased by 8.4%. All other tumour streams showed a decrease of at least 1.8%. When we look at this more closely in 6-monthly intervals from the beginning of 2019 to the end of 2020, we can see there was a steady decline in the total number of new patients across almost all tumour streams. The next area we looked at was the impact to inpatient procedures. 2020 saw a significant decline in the number of procedures performed. The procedures with the highest drops were scopes, diagnostic procedures, and biopsies. The only procedure that saw an increase was chemotherapy by 8.1%. Finally, we drilled down into allied health interventions to understand if there was any significant impacts. Overall, we found a 1.5% decrease in activity across all allied health interventions between 2019 and 2020. However, when we looked more closely, we found that interventions such as music therapy, podiatry, and dietetics saw a decrease, whereas interventions such as diabetes education, prosthetics and orthotics, and pastoral care saw an increase. Thanks for joining us while we explore the impacts of COVID-19 on WCMICS health services.